Yeah, my name is Holm. I'm a consultant psychiatrist and professor of psychiatry. I'm editor of Global Psychiatry Archives, and I wanted to give an overview about a patient which has been done in the Ukraine, and sadly it's very actual. There's some interesting but also unexpected findings, but we come to that. And this is about depression in adolescents exposed to war trauma, and it's a look about the different risk factors for development of depression in adolescents exposed to war trauma. So this study followed up a sample of 149 patients over over a year. They had 3 assessments, and the age was around 15. And interestingly enough, there is a comparison between those with PTSD and non-PTSD. And essentially, there are no big differences in those with and without PTSD. People have had traumata, and the number of traumata was between 3 and 4, and in the PTSD group, and less in the non-PTSD group. But the shocking effect is how many people had war exposure, such as bombardments, rifle fire, injuries, parents' injuries. Nearly 50% or more than 50% saw dead bodies. They lived in shelters, and their own houses were damaged. So quite horrendous exposure to trauma. So the assessment was, initially 483 people were contacted, but only 149 were followed up. Some fell out because they had other diseases, and others were not followed up completely. So there were quite different assessments, and so they had different types of healthcare for those who had PTSD. One had trauma-focused CBT, a third. Some received medication, a lower number were hospitalized, and others received regular mental health care. So this is the traumatic exposure and post-displacement. So if people were displaced, they had different types of exposure, which sadly includes bullying, loss of financial status, parents divorced, parents lost job, and grandparents died. But interestingly is that the differences in the traumata is not very much of a difference between, so it's not significant between the groups with PTSD and non-PTSD. So some developed PTSD and some didn't. Right. So there were risk factors for those developing depression, and what we can see is that female gender has been influenced in developing depression. PTSD had a significant impact. Some people had secondary trauma, but that didn't lead to significance, and non-school attending was risk factors. So there were some risk factors for developing depression in children exposed to war-related trauma. And what you can see here is the changes in severity of PTSD over time. So they had more, so let's say not by the people here, the one with the darker sign over the year had less depression. So these are depression scales, Clinical-Administered PTSD Scale. So they had more symptoms or more PTSD related symptoms, and this was consistent over the years. So looking at depression, you could see that over time, those who had PTSD had developed a higher score of depression over time. And the important part here as well is, and this is sometimes unusual, depression with PTSD. So question what led to depression, female gender was not significant. However, secondary trauma was a significant predictor of depression, school non-attendance, as I said already. However, and this is the positive part, those who had a trauma-focused CBT were less likely to develop depression. So that's a positive part, that those who are treated with trauma-focused CBT have a better outcome than those who have no treatment. Right, and this is more or less the result. So there are predictors of PTSD. And in summary, this is a shocking study looking at all these. Just come back to the title and then looking at the summary. The summary more or less is that depression is caused by PTSD, and school non-attendance is a big risk factor, and proper treatment with trauma-focused CBT might prevent some of the development of depression. So sadly, this is still something which is very likely to continue. And I think there's more studies needed, and more studies needed about successful interventions and how they can be rolled out to all those who deserve this. If you're interested in looking at the paper, look at www.globalpsychiatry.co.uk. And if you want to hear more of this type of information, please register for or subscribe to our YouTube channel, Global Psychiatry Archives. Thanks for your interest, and thanks a lot.